Just moments before this newscast, we spoke with Ontario's Minister of Long-Term Care. We're going to show you that interview now. Minister Paul Calandra joins us now. Minister, you say people won't be forced to leave hospitals, but how does the plan work if people don't want to go?
Yeah, look, what the legislation we proposed does allows us to continue the work with respect to assessing a patient's ability to move from hospital into a long-term care home. So what happens right now, frankly, is a doctor will decide that a patient no longer needs to be in an acute care setting and can move back to into the community, back to their home, or into a long-term care home. The patient can say no, and the work stops. What we're proposing to do is continue the work and the conversations with the patient. So let's look at where it is that they wanted to be. What are their homes of preference? What other homes are available if their preferred home is not available? And be able to present that both to the patient in the hospital, as well as look into the long-term care home itself, the options, and see if they're available for somebody to be transferred into. Ultimately, it is the patient who will have the final decision. But the change that we're talking about here allows us to continue the research, allows us to continue that conversation with the patient, who ultimately we want to move from a patient to a resident.
And when you say we will decide, who does that mean? Is that the physician?
Yeah, so the physician themselves will make the determination that a patient no longer needs to be in the hospital, that being in an acute care setting is not the best place for that person, that they should be, as I said, back into the community or back into a long-term care facility. We will then take a look, as I said, what is available. Ultimately, it is the patient themselves who will make that decision, but we will offer to them the homes in and around their preferred choice. Look, we're in a position in long-term care that we have not been in for a very, very long time. We have the ability to be partners, to be part of the solution to the acute care challenges that we're facing now and have faced for decades in this province. And it's a result of the massive amounts of investments we've made in staffing and new buildings, infection prevention and control, so we can be part of the solution. But ultimately, it is the patient who will make that final determination. This legislation just allows us to continue the conversation that before would have been closed.
And if the patient refuses to go to a certain location, will they remain in hospital?
Yes.
Okay. I want to ask you about long-term care homes. Will they be undergoing inspections before anyone is moved to them?
Yeah, as part of the Fixing Long-Term Care Act we passed in the last Parliament, nobody can be discharged into a long-term care home that does not have the ability to care for the person that we are discharging them into. They have to have the appropriate staffing, and part of this proposal will add resources to all of our long-term care homes. You know, we're seeing a lot of patients in the hospital who have challenged dementia, who may require kidney dialysis. So part of this legislation is additional set of resources, 37 million immediately, over 60 million ongoing, to help us address these issues in long-term care homes. We're having a partnership with Baycrest. So there is a lot of good things that are part of this. Ultimately, it is the patient who will make that final determination, and we will work very closely with the patient, with families, to ensure that if we do move them into a home that is not their first choice, while they wait for their first choice to become available, that they will be consulted. They will be close to family, friends, their spouse, because ultimately we know how important family, friends, their spouse is to the care for that person in the long-term care, not just helping with the day-to-day activities, but emotional. We've seen that throughout the pandemic, and of course we want to make sure that that continues.
All right, thank you so much, Minister. That's Minister of Long-Term Care, Paul Calandra.
Thanks for having me.